Of course, the primary sex organ would be this right here. This is the ovary. You can see sitting like this, and you can say how the ovary. If we dissect it out, you can say that it's in the pelvic place. The ovary will release an egg, one every, approximately for some people, it's 28 days, once a month, but it can go 30 days, or sometimes it can go to 48 days. So you guys know what the rhythm method is? Huh?
Rhythm what?
The rhythm method? No? All right. So if you think about the 28 days as usually, let's do this. You got 0, 2 week, and then you have your 4 week, right? So you females should cycle every once a month, 28 days. So you mark this, okay, this is right here is the menstruation flow, right? So you can actually see that. Sometimes you can smell that too.
Oh. Oh my God.
So you gotta wear something, all right? But normally the heavy flow is like 1 to 4 days. Okay? This is known as menstruation. Menstruation. Now normally in that menstruations, you can mark it like around 10 to 14 days, mid of the cycle. This is when you ovulate. And when you ovulate, you release the egg, right? And if you have sex around this area, that normally would be considered as, unless you want to have a child, you're going to become a mother. Not good when you go to school, right? So wear a condom, or what you can say, okay, you know what? Menstruation, 10 or 14 days, no sex. If you really want to, you can say, okay, after menstruation, maybe here, it's okay, right? Or you can say, past that, maybe down here, right before your menstruation. So we call this a rhythm method. This is the poor man, or poor woman birth control. But now you have your condoms and stuff. So you can see that this is not reliable. It's because the menstruation cycle, sometimes it's 28 days, sometimes it's shorter, and sometimes it's longer. So it's not reliable at all. Okay, so do not use this method. But, you know, as a religious professor, no, I'm not religious, but you know what I advocate for, right? Abstinent. Yes, study on your anatomy. That's what you should do. Okay, so she's ovulating every 28 days, and she released the, by the way, what hormone causes ovulation? Very important to know. LH, very good. It's going to release into this. This is the fallopian tube that you see here. Okay. At the end of the fallopian tubes are these little finger-like projection. We call it the fimbrium. It's actually, it's going to call upon the ovary. Come to me, come to me. And so when she released the egg, it's really in the cleft, in the space. But this thing is sweeping it, so, you know, coming this way. So it causes the fluid to move down. Because sometimes you can also have, when the female releases the egg and she has sex, the sperm can penetrate the eggs, right? It forms as a zygote. The point in which the sperm enters the egg is known as fertilization. Most of fertilization occurs in the fallopian tube. Right? Now you can also have fertilization that is going to become outside of the fallopian tube, and that's dangerous because you can have what we call ectopic pregnancy. Ectopic pregnancy is usually is that they can implant somewhere else, but most of the ectopic pregnancy is that the implantation occurs in the fallopian tube, and because the fallopian tube is very thin, it's not ready to receive the enlarged fetus, for example. So this can rupture, leads to internal bleeding, and die. While fertilization occurs in the fallopian tube, right? Let's say day 1. We call it day 1 PC, post-coitus. Okay. And you know what coitus means. Now, usually 4 or 5 days later, the fertilized oocyte moves down into this. Okay? And this is the uterus. Most of the good pregnancy implantations occurs in the uterus. Okay? This way is the uterus. And it's usually preferably into this mid-half of the uterus. If you have pregnancy at too low toward the cervix, that can also have problem as well. There's also, called oscosy. Don't worry about the the opening down here. But you can see how this comes to the end. That we consider as the cervix. You can see here. And of course, you should know that HPV now, there's a vaccine for HPV, human papillomavirus, have predisposition to usually when you get